Hope is on the horizon for one Eastern Oregon community where federal funds could bring a much-needed care unit for expecting mothers. Aspen Shumpert takes us to Baker County.
St. Alphonsus Medical Center here in Baker City is the only hospital in Baker County. And back in 2023, it closed its maternity unit, citing staff shortages, as well as a decrease in the amount of deliveries they were seeing each year. But now some county officials hope that $50 billion in federal funding allocated for rural health care in the One Big Beautiful Bill could end Baker City's maternity care desert. It's been 2.5 years since expecting mothers could deliver babies in Baker County.
That causes an extra level of anxiety.
Access to labor and delivery care is a long drive away. Families have to travel 40 miles to La Grande or 70 miles to Ontario, and the closest NICU is more than 100 miles away in Boise.
Every family should feel secure that they can have the family and the children that they want in the area that they live. It's not the kind of thing that you should go without.
County Commissioner Shane Alderson says the distance can be dangerous.
If you're expecting and there's any kind of a problem, preeclampsia or any other condition that there's a need to have you closer to care.
And in some seasons, that drive can become impossible.
If you consider shutting I-84 down with fire in the summertime or a winter event, we can be closed off and very, very rural in just a short amount of time.
When the maternity unit closed, Alderson's wife was 8 months pregnant. What did you do?
We were able to stay with family, with my brother-in-law over in Idaho. We were there for almost a month and a half. But then on a county level, not everybody has that opportunity.
Like one mother who shared her reality with Alderson last year.
Her water broke and they got in the car, headed for La Grande, and they didn't make it. She ended up giving birth in the floorboard of her vehicle.
This gap in care in rural Oregon doesn't just affect current residents. Alderson says it makes it harder to attract new families to the area.
You want new people to come here and take jobs and work and thrive, and it's kind of hard to entice people to come and start a new family without that service.
Through a new federal initiative established by the One Big Beautiful Bill, the Rural Health Transformation Program will provide $50 billion in grants to states. On November 5th, the Oregon Health Authority applied for $1 billion of that money to support rural health care. The state finds out December 31st if they get that money. Alderson says if the maternity unit comes back, it would almost have to be at St. Al's because there isn't another existing space with a surgical unit.
I'm very hopeful that this might be what we need to bring it back and sustain it in our outlying communities and other counties.
Alderson feels restoring the maternity unit protects mothers, supports families, and could be the lifeline the county needs to attract new residents.
If you want to bring people in, you need housing, you need a very good healthcare system, you need a good school. All of it's so connected that one is bolstered by the other.
We were not able to speak to anyone inside St. Al's today, but they did share this statement with us, saying in part, quote, hospital officials are working with stakeholders to restore maternity care, but there is still challenges like staffing to overcome. St. Al's says it's committed to trying to restore the care if possible. We'll continue to follow if Oregon is granted this funding and how the state plans to use it. Reporting in Baker County, I'm Aspen Shumpert, Idaho's News Channel 7.